Hi, and welcome to my video. In this video, I'll be tackling the topic of the mental illness depression. In doing so, we'll go over the symptoms, risk factors, and treatments, and trying to break down the stigmas against it. That being said, please keep in mind this may be a triggering topic for some. Without further ado, let's begin. Depression is a common mood disorder, more than just sadness in response to life struggles. It can interfere with your ability to work, study, eat, sleep, and enjoy life. Depression can vary in different forms, like persistent depressive disorder, which can last up to 2 years with episodes of major depression along with periods of less severe symptoms, or seasonal affective disorder, in which depression lasts only within the winter and lifts up when spring and summer come along. Now, you may be wondering, what are some signs that I might be able to see in myself, along with others, that show they or I might have depression? Well, here are some symptoms of depression you might be able to see begin to occur. A sudden dislike in things they or you used to enjoy, like going out with friends or hobbies you might have picked up. Extreme tiredness or lack of sleep, and poor hygiene. Examples: not picking up after yourself, skipping out on taking showers, or leaving trash in your room to rot. There are more symptoms like loss of appetite or weight change, and aching all over the body. But that being said, not everyone who has depression experiences all these symptoms. It differs from person to person. Speaking of varying from person to person, you have the risk factors of depression. Risk factors that may be the cause of depression within one's life could just be purely from genetics. Maybe someone in your family had it and now they have passed it down to you. Or worst case scenario, it could stem from a traumatic experience you had when you were younger. For example, growing up in a toxic family, or someone you love died suddenly, out of nowhere, and you just weren't ready to say goodbye. Depression can happen to anyone at any age. So just because you might not have experienced these risk factors doesn't mean you aren't prone to it. Now, even though I didn't speak about this one within the symptoms, I want to make its own separate category: suicide. Suicide is something that's been always associated with depression, usually depression being the catalyst of such acts. With depression comes these feelings of despair and hopelessness. These emotions can cause you to spiral out of control and plant thoughts into your head. Such thoughts being, you're worthless, or the world would be better off without you. These thoughts end up growing until they're all you can think about and actually believe them to be true, leading to actually take action and, well, killing yourself. Some people battle off these urges of suicide by inflicting self-harm upon themselves, but even then, this isn't how you should deal with things. If it eventually gets to this point, please seek help. This leads me off to my last and final topic: treatment. Treatments usually consist of medication, talk therapy, or a combination of the two. Some medications that you may be prescribed are anxiolytic, which relieves anxiety and tension; antipsychotic, that reduces or improves the symptoms of a certain psychiatric condition; or antidepressants, in which it prevents or relieves depression and elevates mood. As for therapies, here are just some: behavior therapy, cognitive behavioral therapy, art therapy, and animal-assisted therapy. But if you're someone who wants to find out ways to help someone you know who does have depression, and you don't want to pressure them to do anything they don't want to, just be there for them. Maybe go over to their house to see how they're doing, or get them to go outside more so they aren't cooped up inside all the time. Or if you're someone who's uncomfortable meeting face-to-face with somebody, there is always online therapy, in which you can speak to someone on the phone or text them about your issues and concerns. Lines are open 24/7, so they are always open to help out. Remember, you aren't weak for wanting help on something you can't control. So please, seek help. And that brings us to the conclusion of the video. In a moment, locations and hotlines you can reach will pop up if you believe you might be showing some of the warning signs of depression, or just want to talk to somebody. So please, write them down. But all in all, I hope you learned something from this video, and use this knowledge to better yourself and others in the future. I hope you enjoy the rest of your day, and thanks for listening.